Hi, everybody, and welcome again to Cancer Rehabilitation, an emerging standard of care. This is going to be a continuation of a conversation with at least two experts that are joining you on this broadcast. As a reminder about myself, I'm Dr. Jay Harness, a general surgeon who's got 36 plus years of experience in focusing on breast cancer patients. It's been my real honor to be a past president of the American Society of Breast Surgeons, Breast Surgery International, and the American Association of Endocrine Surgeons. I'm currently the Chief Medical Officer for the Maple Tree Cancer Alliance, and I remain as a clinical professor of surgery at the University of California, Irvine. At our last broadcast, I talked about Breast Cancer Answers. Breast Cancer Answers is an all-video social media site for breast cancer patients, their family members, and friends. We're very fortunate to have a little over 1,300 videos on the site with nearly 18,000 subscribers, and we recently surpassed 12.5 million views of our videos. Breast Cancer Answers can be found at breastcanceranswers.com, or you can check us out at our Breast Cancer Answers YouTube channel. It's my real honor to co-host this broadcast, as we did the original one with Dr. Leslie Waltke, who is a physical therapist, has her doctorate in physical therapy, and is the founder of the Waltke Cancer Rehabilitation Academy. Leslie has more than 25 years of dedicated clinical oncology rehabilitation services. She's an international speaker, educator, and consultant. She's an award-winning author, and she's the founder of the Recovery Room, an educational social media channel for 9,000 cancer patients and survivors. Hey, Leslie, great to see you again. We really had a great time on our first broadcast, and hopefully a whole bunch of people saw it. And you know what? Why don't we just take, just 2 or 3 minutes just to give a brief overview of the background here, and then we'll have you lead into these new set of slides that we're going to be showing.
That sounds good. Let's do that. So, Jay, as we talked about, cancer rehabilitation addresses the cardiopulmonary, musculoskeletal, integumentary, and functional deficits that people have either from cancer treatment or from the cancer itself, from diagnosis all the way into survivorship. So in a nutshell, what we help people do that are diagnosed with cancer is, number one, they will live better. So we improve quality of life, less pain, less fatigue, less weakness, less functional loss, and we help them live longer. There is clear and compelling evidence that people who are exercising and working with rehabilitation therapists will live longer than those cancer survivors that don't. And we don't know the specific physiology behind that reasoning. Again, whether the exercise is literally affecting the biology of the cancer, whether we're keeping people's ejection fractions higher, or we're keeping their performance status better, or we're making them fall less, or we're keeping them on their chemotherapy delivery programs better. We just don't know. But again, the evidence is there that people live longer. And then there's evidence now that overall survival for cancer survivors who exercise is better than those who don't exercise. And there is evidence that exercise can decrease recurrence risk for people with breast cancer and colon cancer. So that's really amazing, amazing data.
Well, and we talked about in our first broadcast also, Leslie, that unfortunately, you and I are in a growth industry. The number of cancer diagnoses, our populations are increasing in age. We know age is a risk factor for cancer. And the numbers that we're looking at, not only today of cancer survivors and those under treatment, but down the road, we're talking about significant increases in numbers here, aren't we?
Yeah, I think as last time it was measured officially was January of 2019, it was 16.9 million. That is projected to hit 22 million by 2030. Yeah. So yeah, growth industry is an understatement. And again, we're doing it in a time of fewer resources and fewer bodies. There's just less of us to take care of these people. So there's going to be needs to be a shift in who and how we take care of these folks.
Yeah, and our comprehensive teams of people There's real concern right now about decreasing numbers of people like me who are general surgeons, surgical oncologists, medical oncologists. There's a big worry about that. So it really is, we want to emphasize again to our audience, this really is a comprehensive approach to cancer care, of which the physical therapy and exercise in these parts are emerging standards of care and are critical.
Yeah. And again, adding a rehabilitation therapist to your team benefits the patient, but it certainly also benefits the physicians. So the physicians that I work with love having a PT on board because, again, the patient is typically stronger, they're less fatigued, they're more confident, they have less pain, they complain less, they stay on their schedules better, they complain less of the aromatase inhibitor arthralgias, they function better with their neuropathy, they recover faster and more fully from their surgeries. And that's a win-win, again, for us on the medical side, because that patient is cheaper and happier. And it's certainly a win-win for the patient because they are stronger, healthier, happier, more functional, and can get to who they were faster at the end of their treatment.
Yeah, no question about it.
To throw a quick review from our first talk, again, how does rehabilitation function as part of the overall cancer team? So a patient is newly diagnosed with some type of cancer, and then they go through surgery, systemic therapy, possibly radiation, combination of one of those, all of those. And again, each of these highly specialized areas is very targeted, but it's very siloed. So the patient will move from one medical modality to the next, so surgery to chemotherapy to radiation to hormonal biological therapies or whatever it may be, shifting focus and shifting teams. And because each of those medical modalities has the potential to create cardiopulmonary, musculoskeletal, or integumentary or functional deficits, we also want our cancer rehab therapist to jump on board peri-diagnosis. Again, depending on the type of cancer and depending on the initiation of treatment, it's going to fit in there somewhere, but it should be peri-diagnosis is what the evidence suggests. And then as the patient continues through their weeks-long, months-long, sometimes years-long multimodal cancer treatment, the physical therapist is there at each step of the way to, again, address whatever functional deficits or pain or limitations arise from that particular modality. We also have the advantage of me knowing, okay, I know you're going to start chemotherapy in 4 weeks. So I know that you're probably going to be exposed to fatigue, perhaps weakness, that I'm going to start you on a program now that has been proven to decrease the amount of fatigue that you feel. Or I know that you're going to have radiation to the prostate, or I know that you're going to have radiation to your head and neck. So I'm going to put you on a program now that's been designed or shown to decrease your loss associated with that type of treatment. So that, in a nutshell, is the ideal formula or programming that we would like to see our cancer centers throughout the United States offering to their patients.
And then survivorship is one more click on your slide. And
Yep.
then there's a continuum here, isn't there? And there's even potentially a role in the future and even right now for the fitness industry on long-term survivorship and things of that sort. So you've really described in a really important continuum of your impact on patients, both short-term and long-term.
Yep. Yeah. So again, it's very comprehensive. And again, seeing people on an as-needed basis, they'll get as much help as they need. They'll get as little help as they need. We're going to get some people who are healthy. They respond well to their treatment. They don't have a lot of side effects. They already know how to exercise. I may see that person once every 3 months. Okay. And call me if you have any troubles. And then you get other people who are complete train wrecks or have really significant disease burden, somebody with brain metastasis from lung cancer, or somebody who has just lost a leg to sarcoma, or somebody who's dealing with a major spine surgery for multiple myeloma. So again, depending on what the patient is presenting with, we'll treat that. And then again, it's our job to prospectively make sure that we are adapting and getting that patient ready for what's coming up. So that's kind of, if we had to throw cancer rehab on one slide, there you go.